Hello everyone and welcome. This is Joe Minardi. I'm coming at you here with a fairly short point-of-care ultrasound case-based educational presentation that I hope is helpful for you. We'll jump right into it here. This is a case from my archive of my earlier days when I was first still learning point-of-care ultrasound. This is a 23-year-old female who comes in with vaginal bleedings, got some mild cramps, but otherwise looks pretty good, normal vital signs. As a good steward of patient care and someone who likes to save time and find information as quickly as possible, you walked into the room after you'd seen the complaint was vaginal bleeding, and you took the ultrasound in the room with you, or maybe you had a handheld in your pocket, and you just start to take a look, and you see some of these findings that you see here, and just take a look at those, see what you think. And that's pretty much the extent of the findings. And so, think about what's your diagnosis here, and what kind of the plans are you going to make. So think that over a second. Consider what you would do in this situation. So in this case, these were the findings. This particular patient was diagnosed with an early pregnancy that was not previously suspected. It looked like intrauterine pregnancy, so they were discharged home. About 2 weeks later, they had a repeat ultrasound where they identified something looked abnormal. That the patient was taken to the operating room the next day, and where it was discovered that this was indeed a right tubal ectopic pregnancy. So just looking at the findings a little bit here, one thing I want to point out, and you can kind of see in these initial images right here, if I pause this here, so we have this thing. This looks could very easily be thought to be a uterus with a pregnancy inside of it. But what I want to point out, probably best about right here, this is actually the uterus down here. This is probably the bladder. I'm not 100% sure. I think this is probably the bladder, but this is the uterus down here, and this is going to lead to the most important point of what can happen with cases like this. And these cases have happened. Multiple case reports of images like this. It's a pitfall that we definitely want to avoid, because luckily this patient did well, but could have been a much worse outcome. So here's the uterus. This is the ectopic pregnancy, just outlining uterus. And then this whole thing that looked like an IUP, had a heartbeat, is an ectopic pregnancy. So how can you avoid this? You don't want this to happen to you. You don't want this to happen to your patients. And as with all of ultrasound, making a mistake is not a reason to stop doing it. Making a mistake is a reason to examine your mistakes and get better. Just like if you have a bad airway experience and something goes wrong, you don't stop doing airways. You look at how to improve and get better so that you don't have those mistakes the next time. So a couple of things, most important thing, and things that I've decided to do, and again, after making mistakes and missing things, is just be a little bit systematic about defining the anatomy that you're looking at. So always just kind of go through and identify the normal structures, or the structures that should be there, like the bladder. Fan through the bladder completely. Identify the entirety of the uterus, including all the borders all the way up to the fundus, and get sagittal and transverse views. And you should always, even if you're just doing a transabdominal evaluation, you should always at least attempt to evaluate the adnexa. And something I do, and I try to teach folks to do to help them get better at this skill, is anytime you're looking at in the pelvis in a female patient, if you're looking at the bladder as part of a renal ultrasound or as part of a FAST exam, you should just practice in trying to evaluate and visualize the uterus, its entire borders, and try to visualize the adnexa, so that when the time comes and when it's difficult, when you need these skills, you'll have a little bit more practice at it. So the cautions are, the location of the pregnancy is incredibly important, and you clearly want to define, once you find a pregnancy, don't just be happy you found a pregnancy, and that can happen a lot. We have this psychological tendency or bias, the satisfaction of search fallacy, where you kind of are looking for a thing, you find a thing, and then you stop looking around even further, and we have to avoid that. We have to be more systematic. Pay attention, just because you see a pregnancy, it should be in the fundus, so define the fundus. Make sure you see the borders of the uterus, including the fundus, and all the way down towards the cervix. A normal pregnancy should be relatively high up. It should be relatively central. And another thing I like to look for is, especially if it's an earlier pregnancy, does it kind of unzip the zipper of the endometrial lining? And I'll show you kind of what I mean by that. So first off, these are just examples where you see here, this is the uterine fundus here, and we see this pregnancy is up in the fundus. It's in the kind of the bigger part of the uterus, and it's relatively central. Here again, relatively central. It's in the big part of the uterus. We see plenty of myometrium surrounding this. There are measurements you can do to look at the thickness of the myometrial mantle. I don't often measure it. I make an eyeball judgment of, is it kind of high? Is it central? Is there a reasonable amount of myometrium around it? If I have concerns, then maybe I would break out the calipers. But if any of you guys have listened to my things, you know I hate calipers. I hate stopping. I hate freezing. I take clips. I make judgments and move on the best I can, and only save calipers for limited extenuating circumstances. So I think of the endometrial lining as a zipper, and if there's a pregnancy in there, so it should unzip that endometrial lining, and that's where that pregnancy should be sitting. And if you're not sure, it doesn't clearly kind of open up and sit within that endometrial lining, then you should be more suspicious and look around, take some more views, get some different angles to help you decide, is this a concern or not? Even though the interstitial ectopic pregnancy is pretty rare, we don't want to miss it, and we definitely don't want to miss an ectopic pregnancy because we didn't define the borders and the anatomy of the uterus when we were doing our scan. So the interstitial or cervical ectopic, kind of just things to remember. Again, I don't like to memorize measurements. If it's too close to the edge, if it's too low, then you should get more concerned. And then if it does look like it's too close to the edge or too low, then maybe you do need to break out those calipers and look at the myometrial mantle. These are just some examples, probably yanked from your favorite ultrasound textbook, where here we identify the uterus. I don't really see the endometrial stripe that well in this example, but we see this pregnancy is clearly kind of external or off of the edge of the uterus, and it's too far off the edge. It's not central, it's not in the meaty part of the uterus, so this is abnormal. And again, don't forget that many ectopic pregnancies, they don't look like normal pregnancies. They're just strange looking, usually echogenic masses. They don't always have they often do not have your normal progression of yolk sac and cardiac activity. Sometimes they're just echogenic masses sitting in the wrong place, and the pregnancy test is positive, and that's all you got. This is another one here. This is the uterus. We do see some endometrial stripe. There might even be an IUD in there. I'm not 100% sure. And this is a pregnancy. Again, it just looks like an echogenic abnormal mass, but it's sitting off of the edge of the uterus. So this is an interstitial ectopic as well. Here's another one. It's just sitting way too low. Now it does look almost like it's sitting in the endometrial lining. This is a patient who had a previous C-section, so they had a C-section scar. Those are not common. Interstitial ectopics are never super common, but in the world of interstitial ectopics, a commonly described placement is in a C-section scar. So that's what we have going on here. This would be a tough case. I'm not sure if I would be able to identify that 100% or not. Here's another one where, again, this is the fundus here, right? This is the biggest, the thickest, and largest part of the uterus, and the pregnancy is just in the wrong place. It's not high up. It's not central. It's kind of sitting down towards the cervix. So this looks like a cervical ectopic. And these are high mortality, and you definitely want to recognize these. But the whole point is identify the uterus itself in its entirety to the best of your ability, look for the endometrial stripe, and then ask yourself, if you find a pregnancy, is it sitting where it should sit? Is it sitting relatively central and towards the fundus of the uterus in the meaty part? And just as a reminder of the kind of constellation of findings that suggest an ectopic is, 1, no intrauterine pregnancy. Well, to say that, you make sure you've looked at the uterus in its entirety and don't just stop when you see a pregnancy. And then next up is an adnexal mass, or it could be a mass next to the uterus if we're talking an interstitial ectopic. And sometimes they look like a pregnancy following their normal progressions, but oftentimes they do not. Oftentimes they're just a strange looking, usually echogenic mass. They're not simple cysts and things like that. And then if it's ruptured, you may see excessive or complex free fluid. If it's not ruptured, you may not see that. So just the reminders to help you avoid mistakes, just systematically define the anatomy. And I go find the bladder first. That's the first thing I do, is find the bladder, fan through it, define the borders of it, and then I look for the uterus and I define the borders of that, making sure I see all around the fundus and all the way down to the cervix. I always try to see the adnexa. Sometimes you can't see them with a transabdominal technique, but I always make an attempt. And then just, again, reminder that ectopics may just be strange looking masses and may not look like normal pregnancies. And just a few examples here. So here's one. This one is kind of more similar to the case we just looked at. So you kind of walk in the room, you do your transabdominal scanning, and this one they do a nice job. I'm going to slow this down a little bit here. So your first thing looks like this is a transverse view of the bladder, and that's where I like to start, is just identify that. Now as we're scanning through here, we start to notice, okay, there's probably too much fluid in this pelvis. If I can see a fair amount of it with just my transabdominal technique, that should get my alerts up at least. This looks like this is probably the uterus here. This probably is the endometrial stripe. So that, again, we're trying to define that anatomy, but we see a lot of fluid all around this here. So that I can't really clearly identify the adnexa in this clip, but you see the uterus, you see a lot of free fluid. There's nothing in that uterus that I can see, so if the pregnancy test is positive, this should get you concerned. This is the same case continuing on. This, I believe, are some sagittal views, and then you see something here, you think, oh, that looks like a pregnancy, and you zoom in a little bit, that certainly looks like a pregnancy. There's a yolk sac in there, and it's a little tough to see, but there's actually cardiac activity here. So this is a pregnancy with a yolk sac and cardiac activity. And if you weren't careful and you just looked at that, you might say, oh, well, there's the pregnancy, everything's okay, and you kick them on the way. But what you need to do is, which was a nice job done in this case, define the uterine borders, define where is that pregnancy in relation to the uterus, and is it in the uterus or not? Is it in the right place in the uterus? So these are just further examples in that case. Again, way too much free fluid here. This is uterus. Now some of this fluid is looking kind of complex. Some of this is kind of clot. Here we see some of this fluid, this gray stuff in here, this is blood that started to clot. So this is a ruptured ectopic. Uterus here, endometrial stripe. I think this is bladder, so we're in a sagittal view. So this is, and we saw a pregnancy, it was not in that uterus. So this is not only an ectopic, this is a ruptured ectopic. So this is not someone who's a candidate for medical therapy. They need surgery. Hopefully they're still stable. I'm not sure what the scenario was here. And just a few other examples here. So these are some transvaginal views. So this is, again, a patient with a positive pregnancy test where we see, again, uterus. We define the borders. This is bladder here, I believe. Uterus, define the borders, endometrial stripe. This is free fluid, and this is a large mass. Again, we're kind of towards the cervix here in a transverse orientation. Mass in the pelvis, free fluid. Some of this fluid looks like it's kind of complex. This is probably clotted. This is a ruptured ectopic once again. This is another example that was a very near miss, where we've got, you just kind of put the probe on the abdomen, and you see this looks like a pregnancy. You could even kind of say, oh, does that look like uterus? I'm not sure. But you want to keep sweeping, keep fanning through. This is nearly a 12-week gestation ectopic pregnancy. And you see there's probably a little fluid here. Some of this is just decidual reaction and things, but there's also a lot of clotted blood. This was actually an ectopic, and on first glance looked like, oh, this is a normal pregnancy. But as you fan through more, you define the uterus. This pregnancy was not in the uterus at all. So this is another example of an ectopic that looks like a pregnancy that's in the wrong place. And then here, this a little more subtle, where you've got, so starting at the top here, you got uterus here, endometrial stripe. This is the right ovary. So we've got empty uterus, normal right ovary, free fluid. Decided it was normal in this case. And over here on the left ovary, we see an echogenic mass right next to that left ovary. This is actually an unruptured ectopic. And you see how you find the ovary. If you just look at the ovary, it looked normal, but you got to fan all the way through there and identify that subtle echogenic mass adjacent to or attached to that left ovary, and that's an ectopic pregnancy. And in this case, we have a little review. This patient had normal vital signs, a low HCG level, the ectopic was small, and there were no signs of rupture, so this was a potential medical therapy candidate, which is an important distinction. This is just another example in the adnexa. So we see this, again, patient with a positive pregnancy test, nothing in the uterus. This is a simple cyst. This is not the ectopic, but this echogenic mass here adjacent to or attached to the ovary, this is the ectopic pregnancy. So again, it just looks like an echogenic mass, doesn't look super distinct. So you have to be just aware of what that looks like. And again, a reminder, it does not always look like a normal pregnancy, just in the wrong place. So just a quick summary. So avoid the satisfaction of search. Kind of be systematic every time. Look at your anatomy, identify the bladder and its borders, identify the uterus and its borders, the endometrial stripe, and do your best to identify the adnexa and look and see if there's any free fluid. Is there too much free fluid? Is it starting to look gray and complex? And if you see a pregnancy, be very specific and meticulous about defining where is that pregnancy. Do I see the borders of the uterus? Is it within the uterus? And if it is in the uterus, is it in the right spot? Is it high up towards the fundus? Is it fairly central? Does it sit within that endometrial stripe? These are things that are going to keep you out of trouble. Remember, the masses often don't look like normal pregnancies. Sometimes they do, which can probably make things harder, but they're often just these echogenic, complex-looking things sitting in the wrong place. And then signs of rupture are if there's just too much free fluid, or if it has any signs of complexity or blood that's starting to clot. So if it starts to look gray or you see little layers of things in it, then that's a sign of rupture. I think that's everything on this case for today. I hope this review and these findings were helpful, and we'll see you again on one of the next ones. Thanks.